everyone, welcome back to a new episode of a MemoMap, and today we are going to explore an important topic, which is the blood pressure changes during the exercise. And before we talk, we need to build a strong foundation, reviewing the basic blood pressures. The blood pressures basics. Here we are talking about a four important terms: the systolic blood pressure, the maximum pressure inside the artery during the systole, when the heart contracts and pumps the blood to the circulation. The second one is the diastolic blood pressure, which is the lowest pressures during the ventricular diastole, when the heart is relaxed and filled with the blood. The pulse pressures is the systolic minus the diastolic. And now let's move to the mean or average blood pressure, or the mean arterial blood pressure, which is the average pressure throughout one complete cardiac cycle. Here, let me ask you something. How to estimate the average blood pressures? Most of you will say that the average simply equals the systolic plus the diastolic divided by 2, but this is incorrect because the heart does not spend equal time in the systole and diastole. The diastolic is longer than the systolic pressures, and accordingly the average blood pressures equal the diastole plus one third the pulse pressures. What determines the average blood pressures? Well, the average blood pressure is determined by two major factors: the heart and the blood vessel. And in the heart, the main factor is the cardiac output, which equals the heart rate and the stroke volume. For the vessels is the total peripheral resistance. And here, it is an important to note that the stroke volume mainly affects the systolic pressures. When stroke increase, mainly the systolic increase even more than the diastole. Why? Because when the heart ejects large volume of blood with each beat, the peak pressures rises. So the increase in stroke produce marked increase in systole. Remember S for S. What about the total peripheral resistance? It affects mainly the diastolic pressures. Why? Because when the arteriole become more constricted, the resistance increase and blood leaves the artery slow. This increase the diastolic as the blood remain in the diastole more than in the systole. So the increase in the peripheral cause marked increase in the diastolic pressures. Now moving to the second point in our topic today, regulation of blood pressure. How is pressure regulated? Actually, we have three major regulatory mechanisms: the rapid neural, the intermediate capillary, and the slow hormone and kidney. So starting with the fastest responses, which is the rapid neural regulation of blood pressure. And now let's move to the neural regulation of blood pressures. And to make this topic easy, we are going to focus on three things: the center, receptor, and effector. But we are going to start with the center, which is the vasomotor centers, and it's located in the medulla oblongata, and it is divided into two functional areas: the pressors and the pressors area. Remember the pressors area, sympathetic, responsible for elevating of blood pressures. It is divided into two main important components: the cardiac stimulatory centers and the vasoconstrict center. The cardiac stimulatory centers sending a sympathetic to the atrium and ventricle, increasing the heart rate and the ventricular contraction, while the vasoconstrictor centers sending the stimulation to the arteriole and the vein, constrict of the artery resulting in increasing the total peripheral, constrict of the vein increasing the venous return. Moving the depressors area. The depressors area is responsible for the lowering of the blood pressures, and it has two areas: the cardiac inhibitory area and the vasodilating center. For the cardiac inhibitory area, it sends the parasympathetic vagus to the SA node and AV node, so it mainly decreases the heart rate, has no effect on the ventricle or the contractility. Remember this. The vasodilators, remember, it has no direct effect on the blood vessels. The parasympathetic has no effect on the blood vessels. So, how does it cause a vasodilatation? Simply through the indirect inhibition of the vasoconstricting center, resulting in the vasodilatation of the artery and the vein. What about the receptors for the vasomotors? We have four main receptors, starting with the major two receptors, which are the baroreceptors and the chemoreceptors, and we are going to compare between them according to the six main important points: the location, the afferent, the stimulus, the effective on the effective blood pressure range, and the response. Starting with the location, both are located in the carotid and the aorta, but remember the carotid sinus aortic arch, the peripheral carotid and aortic body. Regarding the afferent nerves, both sending a buffering nerve to the vasomotor, it is nerve 9 and 10. Regarding the stimulation or the stimuli, the baroreceptor respond to stretch, thus changing in the blood pressure and pulse, while the peripheral chemoreceptor to the chemical changes such as the increased carbon dioxide, hydrogen, and decrease in the oxygen. So, how about the effective pressure range response? The baroreceptor responds to change in pressure between 60 to 180, while the chemo respond to change in the pressures from 40 to 60 millimeter mercury. Remember that the hypotension decreasing the blood flow, and this result in the increased carbon dioxide, hydrogen, and decrease the oxygen. So remember that for the baroreceptors, normally it sends an inhibition to the pressors area. However, with increasing the blood pressure, the inhibitory response increased. With dropping of the blood pressure, the inhibitory responses will decrease. What about the other two receptors? They're important, appear mainly with exercise, which are the cerebral cortex, responsible for central command and activation of the pressors area. The second is proprioceptors, present in the muscles and joint, activate during exercise, resulting in the activation of the pressors area. So, before we leave this point, remember that we have three major input to the vasomotor centers. To remember them, remember 3B and C: brain, baroreceptors, and the proprioceptives, and the C is the chemoreceptors. And now let's move to the second mechanisms for the regulation of the blood pressures, which is the capillary regulation. And before we talked about this, we need to remember the two main characteristics of the capillary blood flow. First, it is a slow. Why? Because it has a numerous total cross section, and increasing in the cross section will resulting in the decrease in the flow. The second is the capillary flow is intermittent, not continuous. Why? Due to contraction or relaxation of precapillary sphincters, and this depends on the metabolite. The increase the metabolite will relax the precapillary sphincters. How does the capillary help in regulation of the blood pressures? This depending on the pressures inside the capillary. We have two type of pressure: the hydrostatic pressures, which depend on the plasma volume, and the oncotic pressures, which depend on the plasma protein. And remember, the hydrostatics always affecting the water's movement, since it's changeable, while the oncotic, since it depends on the plasma protein, usually it is constant. So the increasing in the hydrostatic pressure will push more the waters or fluid from the capillary to the interstitial. Now, what will happen when the blood pressures increase? When the blood pressures increases, so the hydrostatic pressures will increase, and this will increase the movement of water from the capillary to the interstitium. That's to say, increasing the filtrations, and increase in the filtration will decrease the plasma volume. and this venous return. This will decrease the cardiac output and the blood pressure. What happens when the blood volume and blood pressure decrease? The opposite occur. The hydrostatic decrease and the filtration decrease, while the plasma volume increases with the venous return, so the cardiac output and blood pressure increase. The final part for the regulation of the blood pressure is the hormone and the kidney. And to remember the three major R hormone. The hormone was started with A hormone, which are the angiotensin, aldosterone, antidiuretics, and the atrial natriuretic peptide. Remember that the angiotensin system, or the RAS system, started by the renin secreted from the kidney, converting the angiotensin to angiotensin 1, and then angiotensin 1 convert to angiotensin 2. The antidiuretic secreted from the posterior pituitary, while the anti-natriuretic peptide is secreted from the atrium. So when the blood pressures fall, both the angiotensin antidiuretics increase. When the blood pressures increase, mainly the atrial natriuretic peptide is increased. Both hormones act on the blood vessels in the kidney. The RAS and antidiuretics hormones causing a vasoconstrict, while the atrial natriuretic cause a vasodilatation on the kidney. The RAS and antidiuretic hormone reabsorbed or decrease the excretion of sodium and water, while the atrial natriuretics do the opposite. It enhances the excretions of the salt and water. So let's now, after we finished the regulation of blood pressures, talk about the exercise. And here we have two types of exercise: the isometric, which is the static exercise, like weight lift. In this condition, both systolic and diastolic pressures increase. The systolic increase due to increase the stroke volume. The diastolic increase due to sustained contraction that compress the vessels, increasing the peripheral resistance. And the second type of the exercise is the isotonic or dynamic, as in running or swimming. And here only the systolic increase, but the diastolic pressure remain constant or unchanged. Now we reach to the final part of our MemoMap. Let's recap together. Today we talked about the change of the blood pressures during the exercise. First, we started with the basics of the blood pressures, and we discussed the systolic, diastolic pressures, and the average pressures. Remember that the average pressure is estimated by the diastolic plus 1/3 pulse pressure. Then we discussed the major three components, which are heart rate, stroke volume, total peripheral resistance that affect the blood pressure. Remember, S4S, systolic mainly affected by the stroke, the diastolic mainly affected by the resistance. Then we start about the regulation of the blood pressures. The rapid neural regulation, we talked about the center and receptors. We have vasomotor centers, which two area, pressures area has a cardiac stimulatory, sympathetic to atrial and ventricle to increase the rate and the contractility. The vasoconstrict, sympathetic to artery and vein to increase the resistance and the venous return. The depressors is formed of cardiac inhibitory and the vasodilator. The cardiac inhibitory vagus to decrease the heart rate. Vasodilate inhibit the vasoconstrict centers. Receptor to the vasomotors are 3B with C. The two in carotid and the aorta are the baro and peripheral chemoreceptors. Remember, there are differences between the baro and chemoreceptors. First, the baroreceptors act when pressures drop to 40 to the baroreceptor act when the pressures change from 60 to 180, while the chemo work when the pressures change from 40 to 60. And the baroreceptors depress the pressure, while the chemoreceptors stimulate the pressures. However, both are present in carotid and the aorta. Both give rise to the buffer nerve. And during exercise, we have another two receptors, which are the proprioceptive in the muscles, activating the pressure center, commands in cerebral cortex, activating the pressure. So remember always 3B and C. And then we move to the rule of capillary in regulation. two character of the capillary: the flow is slow and the flow is intermittent. And for regulation of the blood pressures, this depends on the hydrostatic pressures. The changing in the hydrostatic change the filtrations and the plasma volume, resulting in change in the venous returns and the cardiac output. So now the final part of the regulation, which is the hormonal and the renal, and we have 3R hormone, the renin angiotensin hormone, 3A hormone, three major A hormone, which is the angiotensin, the antidiuretics, and the atrionatriuretic peptide. With the low pressures, mainly the angio and antidiuretic increase. In the high pressure, the atrionatriuretic is increased, and all hormone act on the blood vessels with vasoconstrict or dilate. All act on the kidney with increase or decrease salt and water retentions. And finally, we discuss the change in the pressure in two types of exercise, with isometric, the systolic and diastolic increase. Isotonic is the systolic mainly increase. So remember, the systole increase on all type of exercise, but the diastole increase mainly in the isometric exercise. And that's all for our memo map today. And thank you for watch. See you in next memo map.